Welcome, everyone. We're just going to give it a minute while everybody is flowing through. Thanks for your patience. Thanks for being ready early in the lobby. We really appreciate that. And we are recording, as you might see when you come in, so that we can all get value and watch on demand afterwards as well. Just let some more people come through before I kick it off. And the team will be very busy admitting all in the lobby. Thanks for doing that. Great. I would say we get into it. I know there'll be people joining us all through this. It is all good, but let's start. So welcome to Education with Team. It's a series of educational webinars that we are hosting as Team Medical. I'm Anne-Lone Dalhoff. I'm the Marketing Director of Team Medical Supplies, and I'll introduce our speaker shortly. But firstly, in the spirit of alliance, we would like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. And we pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islanders peoples here today. And then a bit of housekeeping. As you'll realize, all your microphones and cameras are turned off and muted for all participants. So do enjoy your dinner or whatever you're doing while you're listening. It is all safe. Our speaker will share some great information, and there will be a short Q&A at the end. But what's really important is actually we want you to post questions in the chat as Jane is speaking. So right now, all of you, play around, find the chat box up at the top, click chat, open that one, and then put a little hi in there. It doesn't matter what you put in, it is just you getting over the fear of putting something in. So put a hi in now, then when you actually have a question you'd like to put in there, it's much easier. Oh, hi, evening, hello everyone, that is awesome. That is what we'd like you to do. So we'd like you to put in questions all along the presentation. Our marketing team and some of our really knowledgeable reps are sitting there and helping answer questions. Thanks for the thumbs up, claps. And then at the end in the short Q&A, we will capture some of the key themes and bring back and get Jane to answer. So that's how it works with the questions. In the last minutes, there'll be a little snippet of a presentation of Practice Hub, the software that can help with some of all of this compliance behind the scene. And if you're interested in a full demo, when we do the survey at the end, you can just say yes and put in your details there. And then there will be a little survey at the end, and it's just a 1 minute. We hope you'll do it to give us feedback, to bring ideas, what you'd like to hear about next time, and to help those joining in future webinars of us making it even better. That was all the housekeeping. You know the way out wherever you are right now, and bathrooms and everything else. So we will just get moving. So we are very pleased tonight to bring this evening a webinar with Jane Miller, Director of Medical Dental Solutions. And Jane is not only the director, Jane has been a registered nurse. She is a registered nurse and brings a wealth of industry knowledge. Jane has been providing training, auditing, and advice on sterilization procedures for over 10 years. So we're really grateful to have you here and share with us. So I'll now hand over to Jane. Thanks a lot, Jane. And thanks everyone for being here. We appreciate it.
Good evening, everybody. Welcome to an hour of fun-filled learning with something really riveting like infection prevention and control. I'll try and make it as exciting as possible. So please put your questions in the chat box and we'll try and get them all sorted. So why are we here? Principles of infection control as they apply to office-based practice, that's what we are here for. We want to know what specific guidelines relate to the area of our practice. So we have guidelines such as the RACGP 5th edition, the Australian Guidelines for Prevention and Control of Infection in Healthcare, the NHMRC, which was updated in 2021, I believe. So every practice should have a copy of that, and that's the Australian Guidelines for the Prevention and Control of Infection in Healthcare. And we need to understand legislation guidelines and the Australian standards applicable to reprocessing medical devices in our office-based practices. Now, every state has a Public Health Act. I'm just sort of talking about the Queensland one here, but I'm sure that most other states would have similar acts. I know New South Wales does. I know Victoria has the Blue Book, and I was reading about one in Western Australia and the ACT. So I'm pretty certain the Public Health Act covers is in every state. The Public Health Act in the states is a very powerful act, and you need to understand how powerful this is, and especially you probably be able to relate to it, especially after COVID, and you know all the public health directives that came out of our state governments were all done through Public Health Acts. So it's a very strong legislation that is in place in every state. Now, the Act places the onus on the owner and the operators of healthcare facilities to have an ICMP. An ICMP is an infection control management plan. And all healthcare facilities that provide declared health services as defined under the Act must have an existing infection control management plan. And that's basically general practice, dentists, podiatrists, tattooists, day surgeries, so on, so on, so on. The 10 core elements of an infection control management plan are hand washing and hygiene, PPE, management of blood and body fluid exposures, infection control and employee health, immunisation for staff, environmental hygiene, pre-treatment assessment of infection control risks, appropriate use of single-use medical devices and reprocessing of reusable medical devices, delegation of responsibility for infection control. That's a really key item, and process for the investigation of infection control incidents. So they're the 10 core elements that you have. Most of you would probably have those in your policy and procedure manuals anyway, but
Jane, I'm just going to pause you for a second. So thanks. I know this was the introduction you're going to run through, but the sound is dropping out, which we didn't have before we started. So let's just test something before we move on.
Okay, is that better? Can you hear me now?
It is. We get a first comment on very clear. So keep talking, Jane. I think we might have a better connection now.
Yeah, apologies for that. One of the key things is that you can still hear me.
Yeah, the other option we might do is to turn the camera off. I know we'd love to see you while you're presenting, but let's just try that for a little moment. Yeah, exactly. And then you go back sharing the presentation.
A little better? Hopefully that's better. I'll just lift up my microphone so it's closer to my mouth as well. Maybe that'll help.
You're now clear. We're getting thank yous and Jane's voice. So I think it might be the two windows that I could see you had open there. So let's agree we just do a couple more pages.
Yep, and see how we go.
And I think we're right. And if I pause you again, we will find another solution. So off we go. But thanks for the introduction.
Okay. So one of the key things that you all need to understand and be continuously doing is risk assessment. Risk assessment is really important. It's something that you should just have as a routine part of what you do every day. And if a question comes up, then the answer to, if somebody asks you a question about something, then your answer is, have you done a risk assessment on that? Each practice will need to perform regular infection prevention and control risk assessments to identify risks and estimate the likelihood of infection and consequences it occurs. A risk matrix is often useful. Now, this risk matrix that I've got up here, I mean, this is a very common risk matrix. It's not anything, elaborate. You can find different risk matrix on the web or anything, but this is a pretty standard one. So what you want to look at when you're asking a question about how you're reprocessing an item, for instance, you would go, well, what's the likelihood of a person getting an infection if this isn't processed properly? Is it rare? Is it possible? Is it almost certain? So then that's where you find your likelihood. And then what is the consequence of somebody being past this infection? Is it extreme? Is it high? Is it medium? Is it low? So then what you do then on how you reprocess that instrument is based on where you come out as either low, medium, or high on the risk matrix. Talk a little bit more about risk matrix as we go along. So what is infection prevention? It's preventing the spread of bugs, bacteria, and disease. And just always remember, different incubation times. Somebody could be presenting as well, but they may actually be transmitting at that time. And we've seen that a lot with COVID, haven't we? Who's responsible? Well, everybody's responsible. Everybody in the practice is responsible. So all doctors, nurses, and staff need to be taught and competent in hand hygiene. What is standard precautions? What's transmission-based precautions? How do we manage blood and body spills? Principles of cleaning and reprocessing, and where to find more information on the infection prevention in the practice. So who is the designated person in the practice in charge of training and answering questions? And then we also need to keep staff task competency records. So we need to make sure that when people are trained to do procedures or reprocessing, that you mark off that they've been trained and that they're competent. So you need to keep a competency record as well. I think COVID has certainly taught us a lot about standard precaution versus transmission-based precaution, and I think that this would be something that you would be all over now. I don't really think that I have to spend a lot of time on this. I've got these in the slides. So I think you get access to the slides at the end as well. So, you can see this information, but I'm just going to pretty much skip over it because I think we should all be aware of what standard precautions are and then when transmission-based precautions should be considered. So that's when standard precautions alone may not be sufficient, may be insufficient to prevent transmission. So I think that's pretty just run-of-the-mill in today's world. So do you know your facility's policy and procedures around reprocessing of medical devices? Do you have a policy and procedure manual? Do you have that Bible that you can go to? How do we prepare for the day? What are the things that we need to do every day before we start reprocessing our devices? What risk management do we need to do? How is our area set up? Does it comply with guidelines and with these standards? What do we need to do to reprocess? What documentation do we need to do? How do we load and unload the sterilizer? When do we load and unload the sterilizer? When do we have performance qualification done? That's your validation. When is that performed? And when we store our sterile stock, do we clean all of our areas where we store our sterile stock? So preparing for the day, what chemicals do we use? What testing do we need to do? Have we done the appropriate risk assessments? Do we have all the appropriate materials to do our jobs? And what do we do with our clinical waste? So thinking about chemicals, I'm going to bang on about that and you'll hear me talk a lot about that. There is no room in any surgery in the clinical areas for any chemicals or detergents that aren't registered on the ARTG. So no nice hand wash in clinical areas. If you want to put them in the toilet or in your kitchen, that's fine, but not in clinical areas. Identify and use appropriate personal protection. So PPE, what are we doing? And applying it and removing it correctly. So because we're talking about reprocessing at the moment, using rubber gloves for housekeeping and cleaning of instruments is what's recommended, not your standard gloves that you use in the procedure room. So if you're using just standard examination gloves for cleaning of instruments, you're using the wrong gloves. So you need to look at what the guidelines say and what you should be using for your own personal protection. Also, goggles and face shields, I think, they get left off so often people just forget to put on goggles and face shields, or they're considered an inconvenience, or they're too expensive. All of these reasons why people don't use them. I think, we need to be making sure that we're using the correct gloves, that we've got aprons to protect our clothing, that we're using face shields or goggles, and that we always have the correct mask on to prevent any risk of droplet spread. And, the gown is the gown or protective, like the plastic apron, is really important. I think, we don't put enough emphasis on covering our clothes when we're in there processing instruments. But you've got to remember that, you're splashing back onto yourself, you're cleaning instruments that could be contaminated, you're putting that on your clothes. If you're a mum, if you're not changing at the end of it, you're going, to the daycare, you're picking up your kids, you've got all this stuff splashed on your clothes. Do you really want to be spreading that, to your family, to the community or whatever? So, make sure that you're covering up, that you're wearing waterproof apparel so that you don't contaminate yourself or your clothes. Just donning and how to put on and take off. You should have these posters up around your surgery so that you know how to use them. Same as your hand washing posters. They should be all around your surgery, and your mask etiquette, and so on and so forth. We also need to have a cleaning policy for the practice. So all practices need a cleaning policy that includes both the routine scheduled cleaning of all surfaces and equipment to reduce dust and dirt, which can harbour microorganisms, which is documented and signed for. So you may not have an auditor that comes in for your AgPal auditing that may not ask, they may not ask for your documentation on your cleaning schedule. But if by some chance of fate you have a public health officer come in and do an audit, they will ask for documented evidence of your cleaning schedule. So don't forget to document when you clean, how you clean, and who's cleaning and what day it is, and make sure it aligns with your policy and procedure manual. And what you say you're going to do in your policy and procedure manual, you need to be doing. And all staff should be included in the cleaning policy, because the girls on the front desk would be cleaning their own areas. They may be cleaning the waiting room, doing that sort of thing. Clinical staff will be cleaning different areas, doing different things. We need to make sure that frequently touched surfaces, such as and including toys, should be cleaned with a clinical detergent. Needs to be TGA approved, at least daily, or when visibly soiled, or after every known contamination by a likely pathogen of source. I know a lot of surgeries recently have, especially after COVID, have got rid of all magazines. They don't even have them in the surgery anymore. And a lot of surgeries have got rid of toys and kids' play areas for exactly that reason. So because you're having to clean them constantly after children have been touching them, because it's just too much of a risk. But that's for you to do a risk assessment on and decide what's best for your surgery.
Hey Jane, it's Anne Lone here, just jumping in again. Maybe it's the microphone that just needs to get a bit closer again. It started dropping out a tiny bit.
Is okay. I'll try and keep it right
perfect.
up close.
Beautiful.
Yep. Okay. Designated responsibility. So you've got to have a person who is responsible for the practice's cleaning policies. You need to have a written schedule. When is cleaning to be performed? You need to have a risk assessment around those cleaning processes, and staff need to be trained, and you need to be using TGA approved products. So when we're cleaning, we don't want to redistribute bugs across surfaces again. So you may use a two-step cleaning process. So you clean and dry first before you disinfect. So that's just, a detergent, neutral detergent or whatever. Cleaning does not necessarily kill germs, but by removing them, it lowers their numbers and the risk of spreading infection. Disinfecting does not necessarily clean dirty surfaces or remove germs, but by cleaning germs on a surface, by killing germs, on a surface after cleaning, it can further lower the risk of spreading infection. Now, always use chemicals as per manufacturer's instructions, and make sure you have a material safety data sheet available for every chemical that you use in your surgery. There are, of course, your two-step cleaners that you can get, which is products like, and I'm just giving out names, I'm not recommending any particular product, but I'm just saying, a product like ViraCleanse is a two-step cleaner. So it's a cleaning disinfectant. So, you know, if you want to use those sorts of products instead of using 2, then there's, you know, no reason why you can't do that. It's a bit contentious about spacers and nebulizers and masks, but most spacers, nebulizer devices and masks are single patient use items and should be given to the patient for further use or discarded after use. Oxygen tubing is always a single patient use only and must be discarded. Some items, such as sterilizable spacers, may be cleaned and reprocessed in a sterilizer and used on other patients, but that is dependent on the manufacturer's instructions, and you need to read the instructions for use when you get that spacer. If the manufacturer says it can't be used on reprocessed and used on another patient, then you can't do it. So always read your manufacturer's instructions. In these instances, if the manufacturer has said that you can reprocess it, then you must follow their instructions on how to reprocess. Spacers, nebulizers, and masks are not required to be sterile at the time of use and need to be stored in a clean and dry environment. The reprocessing cycle is more than just putting instruments through a sterilizer. It's the entire process, which begins with initial cleaning of your reusable medical devices and continues through to cycle monitoring and storage ready for reuse. The process of sterility assurance includes all aspects of equipment reprocessing, performance qualification, and staff education. So that's the whole process, right from point of use all the way through to back in a bag and stored on the shelf ready for reuse again. So why is the cleaning process so important? So cleaning agents, now, because I've taken some of this wording straight out of the standards, whenever you hear somebody use the term shall is a mandatory requirement. If you hear the word should, it's a recommendation. So when I say the word shall, it means this is what you have to do. So cleaning agents shall be used to remove residual soil and organic matter from instruments and equipment. Only those intended by the manufacturer for use in cleaning medical devices shall be used. So once again, you can't use, you know, palm olive from the supermarket. You have to use a detergent that has been specifically approved by the ARTG. Now, initial treatment makes definitive cleaning easier. So definitive cleaning is the final cleaning process that you do before you bag it and put it in the sterilizer. Initial treatment of soiled devices reduces the bioburden and the potential bioburden. So what's bioburden? Bioburden is the population of viable microorganisms on or in a product or sterile barrier system. And the potential bioburden, that's the amount of microorganisms that can rapidly multiply in blood and other organic contamination. So this is why, you know, it's really important that we treat instruments at the point of use, clean off blood, clean off, you know, pus, whatever is on those instruments, wipe them off initially at the point of use so that you're reducing the potential bioburden that can grow on those instruments. Because if you can get rid of them then at the point of use, it makes your cleaning process a lot more effective. So let's start the day. So we're going to check our detergent. Are you using it at the correct dilution? Now, please, 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 if you have not read the label on your detergent, tomorrow morning, first thing you do, pull the detergent out of the cupboard and read the label. Make sure you are only diluting the detergent at exactly the amount that the manufacturer is telling you to do on that label. Also, please check the expiry date. Test your ultrasonic cleaner. That's the other thing we're going to do first up in the morning. Are you going to use Hendrix or foil? So if you're going to use foil in your ultrasonic cleaner, the correct procedure is to fill up your ultrasonic. You put in your detergent, you degas it, then you put in your foil. Now, to put in your foil, as per the ultrasonic Australian standard, you have to suspend 3 sheets of foil in the tank of your ultrasonic. So you have to run like have 3 like pieces of wire or something across the top, or you know, like a a wooden skewer or something. I don't know what it is, but you would then hook your aluminium foil over those 3 suspension devices. You would let your foil sit in the tank, and then you would run your ultrasonic for 30 seconds. Then you would need to pull out each of the 3 sheets of foil. You would then need to look at those 3 sheets of foil and make sure that you have consistent hole all the way through those 3 sheets of foil. Then you would need to empty out your ultrasonic. You'd need to rinse it out, make sure you get all that residual aluminium foil out of the ultrasonic. Then you fill it up again. Then you put more detergent in it. Then you degas it again, and then you're right to go. So if you're using foil and you're testing it correctly, that's the process that you need to do. If you're not doing that process, you're not testing it correctly. So that's going to take a lot of time. Plus, you're using double the detergent to begin the day. Hence why I always recommend a Hendrix test. A Hendrix test is just a simple disc that you shade pencil onto it. You pop that into your ultrasonic after you've put your detergent in and degassed it. You run it for, I think it's 6 minutes off the top of my head. And then after the 6 minutes that you've run it, you pull the pencil out. You make sure that all the shaded pencil that you've put on the disc has lifted and is gone. And then once you do that, the device is ready for the day. Much, much easier, much cheaper, and much quicker to do to test your ultrasonic. And you know, you'll get some pushback and go, oh, but you can buy foil from the supermarket. It's only a couple of bucks. The Hendrix test is, you know, $50, $60 or whatever. But when you take into consideration all the time and the double detergent, it actually works out a lot cheaper to do that. There's other types of tests that you can get, which are the Getinge assured tests as well that you can use. They're a little bit more expensive than the Hendrix test, but they still work just as well. Does your sterilizer have a vacuum pump? Do you need to perform a vacuum test? Have you done a risk analysis around doing a vacuum test on your machine? How often do you need to do a vacuum test on your machine? And why are you doing a vacuum test on your machine? Do you process hollow equipment or large wrapped pack? Do you need to perform a Bowie-Dick test? Have you done a risk analysis around this based on the type of loads you process? Now, these 2 things are probably some of the sticky questions that I get asked a lot. So basically, you need to know what your machine is. So if you've got, let's pick on MELAG. A lot of people have MELAG out there. So if you've got a 23S machine, you don't have a vacuum pump. So there is no way that you can do a vacuum test. Your machine's never going to pass it. So you don't need to do a vacuum test. If you have a 29VS, a 23VS, V stands for vacuum. So you have a vacuum pump. So you need to test your machine. The RACGP guidelines basically say that you need to test the ability of your machine to pass the vacuum test. So that's why you're doing a vacuum test. And you can basically do a risk analysis around it. I've got some written out risk analysis a bit later. Basically saying you're performing you're performing the vacuum test the capability of the machine. You don't process any hollow instruments. So you can just do the vacuum test once a week. And then maybe set it on Monday mornings, you do your vacuum test. If you have a B-class sterilizer, you may need to do that vacuum test every day, especially if you are processing hollow A type instruments or large packs. You may need to do Bowie-Dick tests. So a lot of and also you need to have the capability of the machine from the manufacturer. So MELAG will often say that the 23VSs won't pass a green card test. So there's no point in even doing a green card test in a machine if the manufacturer is telling you that it's not going to pass. So you need to know the instructions for use from your manufacturer and look up what your machine is capable of and test your machine based on those. So we're going to start our reprocessing. So step 1, we're going to pre-clean. So pre-cleaning is in your treatment consultation room. So following the procedure, while still gloved, remove gross soil from used instruments. So that's just wiping it down or rinsing the instrument. If you've got, you know, a gauze square or an instrument wipe or whatever, you can just wipe your instruments over with a bit of water, if you've got some sterile water or whatever from your procedure. If practicable, transport instruments to the reprocessing area for immediate cleaning. Transport instruments in a container designated for that purpose. So if you're transporting instruments from room to room, they should be in a container with a sealed lid. If you shouldn't be transporting them in an open container because there's a risk of dropping them, damaging the instruments, sharps injuries, all sorts of things. So if you're transporting from room to room, need to be in a container with a sealed lid. If immediate transport and cleaning is not possible, so this could be like for some podiatrists who do home visits, that sort of thing, then you can soak your used instruments for short periods of time in water and detergent until cleaning is possible. I'm having a mental blank. There's a Clini Soak, I think it is. It's a product that's in a squeeze bottle. You can spray your instruments. It has a holding time of about 7 hours. So if you're, say, a mobile podiatrist or something like that, you can use products like that to spray your instruments, put them back in the sealed container until you can get back to your, to actually reprocess them properly. You can, and even in your surgery, if you can't get to clean them straight away, you can soak them for short periods of time. But once again, you need to check the detergent that you're using and check the instructions for use on how long you should be soaking the instruments in. I think Sonident and some others say that they should only have a soaking time of about 20 minutes. So, you need to check what the manufacturer says their detergent can do. So we're going to clean in the reprocessing area. We're going to put on all of our PPE when we're handling soiled instruments, and then we're going to assess the instruments and we're going to make sure that the item is actually suitable to reprocess. So if you've got any single-use instruments with the blue handles, they are definitely not suitable to be reprocessed and shouldn't be reprocessed at all. They should be put in the bin or wherever you put the stainless steel items for recycling. That's where they should go. In the dirty sink, wash all your used instruments with an autoclavable brush. Tepid water is just tap water, straight out of the tap. Okay, no heat in the water at this time because if you've got blood or body products on them, they contain a lot of protein. So if you're using a hot water at this stage, you're potentially setting the protein. So we just use normal tap water. And we want to use an appropriate detergent for that. And once again, I'm going to bang on, it's got to be at the right dilution. Please don't add a little bit more. Had a surgery a few years ago that they were wondering why everything was rusting in their surgery. And they were using Clinident at the time. And when I looked at the bottle that they were using and that they'd mixed it up in, was really quite blue. And I said to them, have you measured, the detergent, how are you doing? And she said, oh, yeah, I did. I looked at that. I measured it. I put it in, but it didn't look blue enough. So I just thought a bit more detergent would help. Well, a little bit more detergent doesn't help. Please don't use more detergent. Only use what the manufacturer says you need to use because otherwise you can potentially be damaging your instrument. So you must also do the correct cleaning process intended for instruments. So like plastics and anything with a wooden handle, there's no point putting them through an ultrasonic. They don't process in an ultrasonic. So make sure you use the correct cleaning process. And also mirrors and anything glass, please don't put them in an ultrasonic as well because they can shatter. Placed used instruments in ultrasonic cleaner or instrument washer disinfectant if that's the way you're going to go and you're not just going to manually wash with a brush. So we're going to rinse and dry after we've either manually cleaned them or put them through the ultrasonic. If you put instruments straight, so if you're going to pre-clean your instruments at the point of use, then you can put them straight into the ultrasonic cleaner. Okay, you can put them straight into the ultrasonic bath. If you're not going to pre-clean at the point of use, then you may find that you need to use a brush and brush the instruments first before putting them into the ultrasonic. But generally, if you clean at the point of use, you should be able to just put them straight into the ultrasonic. So once they're cleaned, in the clean sink, rinse all your instruments and equipment in gently running hot water. So this is when you can use hot water, okay? Final rinse of instruments then needs to be in demineralized water. Now, you may not be using demineralized water at the moment, but you should be. The standards all clearly say that you need to be using the final rinse of instruments in demineralized water. And the new standard that is being developed at this point in time has clear guidelines that you probably have to use demineralized water through the whole process, but definitely the final rinse of your instruments is in demineralized water. Once we've done that final rinse of our instruments, we drain them on a clean surface, either a sink drain, cake rack, or a low lint towel. Now, please don't continue to use the same low lint towel all day so that it's sopping wet and it's not going to do anything. You should be drying your instruments immediately. You shouldn't be leaving them sit there wet on a wet cloth in the stereo room until you can get back to them. And the reason that I'm saying this to you is because if you're leaving your instruments in a wet environment, then you're potentially allowing fire burden to develop on your instruments. And in wet environments, the bug that really thrives in those wet environments is Pseudomonas. So, you want to make sure that you're actually drying all your instruments. As soon as you rinse them, dry them. Once they're dry, you can put them to the side and leave them sitting dry, ready to be repacked. But please don't leave them sitting wet around the sink. You need to check all your instruments and equipment for cleanliness. So at this point, when we're drying them, we're actually checking them, making sure that we've got all the blood and stuff off of them, and that they're absolutely clean. If you see any debris still left on the instruments, please put them back through the reprocessing cycle. So you're going to clean them again. And also, don't forget to clean your brushes at the end of the day and process them in the sterilizer for decontamination as well, because your brushes need to be cleaned as well. They become incredibly dirty, cleaning dirty stuff all day. So you need to wash them at the end of the day and put them in the sterilizer for a clean too. So process for intended use. This is what we're determining how we're going to sterilize or decontaminate our instrument. So if it's a critical item, so that's any item entering sterile tissue, the body cavity, vascular system, and non-intact mucous membranes, so they're all surgical instruments. Our goal is that they're going to be sterile, and we're going to process them through steam sterilization or low temperature methods. Ethylene oxide, I just had a query this week about somebody wanting to buy an ethylene oxide sterilizer from online from China. You need to understand that ethylene oxide is exceedingly flammable. It can blow up. It's also carcinogenic, so please don't even consider buying an ethylene oxide sterilizer. And their rationale was because they were sick of buying in demineralized water. It's honestly, your health risks are so bad. Hydrogen peroxide and plasma sterilizers you'll see in hospitals. You won't generally see them in general practice or day procedure centres. Semi-critical items are items that make contact directly or indirectly with intact mucous membranes. So not that you'd see many gynae speculums much anymore. I think we're pretty much using disposable of those, but some of your speculums, things like that, scopes, throat speculums, they are semi-critical, and we need a high level of thermal disinfection to process those. So that's either a thermal disinfector, or if you don't have a thermal disinfector, which is your washers, then you need to sterilize them. So we're still using our sterilizer for semi-critical items, unless you have the thermal disinfector. Non-critical items is basically anything that comes into contact with intact skin, but not mucous membranes. So that's all your bench tops, your chairs, anything like that. We just need them to be cleaned. So we're going to just clean them using mechanical means or manual means, and maybe disinfect if we need to disinfect them as well. rid of that thing on the top. I don't know. Okay, step 4 is preparing the load for sterilizing. Another question we get asked all the time, do I need to have my instruments wide open? No, you don't. You need to have them open slightly and unlocked. So anything with a hinge or ratchet, they need to be unlocked. They don't need to be wide spread apart. They just need to make sure that they're open so that the steam can penetrate into the box joint. Prepare your instrument trays in accordance with your workplace protocol. So you may have like specific sets or trays of instruments. So whatever your workplace protocol is, you prepare them and put them in their potential packs. You package or wrap critical site instruments in a manner that prevents damage to delicate items. So, you know, your sharps, like your scissors, tips, things like that, they should be in, you can see the holders that I've put down there. Anything with a sharp tip should be in a holder and a protective cover, because they can potentially pierce your bags and put little micro holes in your bags. And if you've got little micro holes in your bags, then your bags aren't going to be sterile. So please always make sure that you prevent damage to the tips and also damage to your packs because of potentially piercing them. Select packaging of appropriate size to match the items to be sterilized. So don't squeeze stuff into a little bag. Make sure that there's about 1 centimetre of spare space around the instruments in the bags. When you seal it, you want to do that because when the packs are inside the sterilizer, during the sterilizing process, when the steam's injected, it's going to puff that bag right up. It's going to, you know, be puffed right to the edge. So if you are overpacking your bags or putting instruments right up to the sides of the bags, you can potentially split the bags. So make sure you pick the right bag for the job. Make sure that each package has a class 1 chemical indicator and seal the package to ensure there are no gaps through which air can enter. When you're putting things into a bag, please follow the procedure of folding the seal first before you put any instruments even through it, making sure that you've got a nice, crisp line across the top. Put your instruments in the correct way so that when you open the pack from the bottom, you're getting handles first. And then when you seal the bag, when you peel the strip off and seal the bag, you've got that nice little I can't think of the word. Anyway, you've half I'm having a real grey moment, sorry. You've already
This is all good, Jane, and you might have guessed that I was just about to jump in because we had this little agreement that I would keep on track.
yeah.
So all good with
Yep. Yeah,
keep
no,
turning
so
on this one.
we just want to seal them and then make sure that you press down and run your fingers right across the top of the bag, and you make sure that there's no holes on either end of the bags, because you want to make sure that bag is 100% sealed, because if you leave little holes on the end of that bag, then once it goes through the sterilizing process, it's not sterile, okay, because there's air gaps that air can get into. We're going to label our packages with the date, the load number, and if required, description of content and the signature of the person responsible for packing. This is your tracking. This is your critical tracking that you need to do. There's lots of different brands around, but the Gatingi documentation systems, including batch identification labels, surgery sterilizer module books, and patient record of sterilized instruments used for reverse tracking are just the bomb. They make life so much easier, and you can always do your reverse tracking. Reverse tracking register can be as simple as a spreadsheet. Ask Gillian, I'm sure she'd be happy to give you this spreadsheet that she's done up so that you can reverse track if you have an incident and you have a patient saying that they've had an infection, then you need to be able to go back to the load. So what sterilizers are out there? What do we use? So in steam sterilization, the combination of heat and moisture maintained at a preset temperature, pressure, time, relationship coagulates cell protein, efficiently killing microorganisms. So that's how steam sterilization works. So there's 3 different types of sterilizers around. An N class you should not see anymore, and I hope nobody still has one, and that is a machine that you can't process any hollow, porous, and it doesn't have a closed door drying. So that means that you have to actually crack the door open for the load to dry. That is not up to standard anymore. S-class cycle is one of the ones that most of you in the medical world will have. And these cycles are designed for a specific group of products as declared by the manufacturer. So once again, you need to be reading the instructions for use from the manufacturer. And generally, they'll be solid instruments and hollow B items. A B-class sterilizer is the ultimate sterilizer that can process hollow A loads, and that's more used in dental and for small hollow tubes like dental handpieces, those sorts of things. Pretty rare to use them in medical practices. You need to understand what type of instruments you have when you're buying a sterilizer, so you choose the right sterilizer when you're buying one. So this is what I was talking about, steam, pressure, temperature relationship. This is very important because just because your sterilizer might not reach 134 degrees, it may still be sterile if your holding time is at 4 minutes. So if your sterilizer is processing at 132 degrees and it's holding for 4 minutes, then your loads are going to be okay. This is important if you have an auditor come in and go, your machine hasn't reached 134 degrees, so it's failed. You need to go back and look at your holding time and make sure your holding time has covered you for the process. This graph is in the Australian standard, so it's very easy for you to find it. Generally, most sterilizers are set for 134 degrees with about a 3.5 minute holding time. Most of your MELAGs hold for 5 minutes. So you will still be safe. If your machine drops below 134 or down to 132, you're holding for 5 minutes, your load is definitely processed and safe to use. So loading the sterilizer, load hollowware, kidney dishes, whatever, on their sides and separate to ensure adequate steam penetration. So please don't have them, stacked way on top of each other. Use load separators like your toast racks and trays to ensure packages are separated and only loosely in contact. Never stacked, never 2 layers of instruments, only a single layer, please. Ensure the load does not exceed the validated challenge load parameters. So check your validation records and packages are not touching the sides of the sterilizer. Do not load beyond the weight capacity of the sterilizer. So make sure you check your instructions for use on your sterilizer to see what your machine is capable of doing. And this is really important. The sterilizing cycle shall be commenced immediately after loading. Quick tip for you all, sterilizer is not a cupboard. Don't use it as a cupboard. You put things in, you turn it on, it finishes, you take them out. It is not a storage container. So on the left is a good example of how we would like you to load your sterilizer, and on the right is let's hope we never see it. So sterilizing the load, always check your water levels. If you don't have a machine that is auto-filling, make sure you check your water levels and add water prior to commencing the load, because if you don't have enough water in it, the machine may fault and stop halfway through the cycle. Select your appropriate sterilizer process. So 134 at 3.5 minutes, close your door and start your sterilizer cycle. Put your records of the load into the sterilizer logbook, your date, load description, load number, identification of the person who prepared the load, and don't attempt to open the sterilizer door while the cycle is in operation. So when you're looking at your recording stuff, you're going to pick that it's a live cycle, that you've got wrapped or unwrapped instruments in the load. If it's a test cycle, a Bowie Dick test, or during service when the technician's there, then you can tick those as well if they relate. Then you put your load in. So you might have, incision kits by 3, you might have forceps by 4, whatever. The only time you need to put incision kit 1, incision kit 2, incision kit 3, or something like that is if you have set packs that are actually sterilized and all the instruments always stay together. If you don't have an instrument pack where all the instruments are totally together all the time and never swapped out with any other instrument, then you can simply put incision pack by 5. Because if you're constantly changing the instruments around that are in that pack, you can't tell which instrument was in which pack. So it's totally irrelevant if you put pack 1, 2, or 3, or 4, or 5. It's just you've got 5 packs in the machine. So that left-hand side is what you're going to be filling out to begin with when we load the sterilizer. After the cycle is finished, we're going to unload the sterilizer. Please don't try and open the door while the cycle is in operation, because you'll just, damage the door or whatever, because you're not going to get it open. When the cycle is completed, make sure you remove the trays and place in a clean area to cool. Take care not to touch hot packs. So it's a good idea to take the trays out and put them on like a cake rack or something like that. Please don't put them straight, hot instruments straight on a bench, because you will get condensation in the packs, and therefore your bags will be contaminated, because you'll get moisture permeating through the bags. You want to make sure that you check your bags for any moisture and damage. Excuse me, if packs are moist when they come out of the sterilizer, the chemical indicators do not have the correct color change, or cycle monitoring of the parameters are not correct, fail the load, investigate the cause. Could be that you've overloaded the machine. You might have put too much on. You might know how many kilos of instruments you're supposed to be able to load in your machine, and re-sterilize the load. If packages are damaged, reprocess the affected items in new packaging. Just as an example, for loads capability of a machine, a 23-litre MELAG can process 6 kilos of instruments when they're unwrapped. But as soon as you wrap those instruments, the load capability goes down to 2 kilograms. So it drops from 6 kilograms of unwrapped to 2 kilograms of wrapped. So that's a big difference, and that's why you need to know what your machine is capable of. Warm items must not be placed on cold surfaces. I just said that because we're going to get condensation. So then, documenting the cycle. In addition to the details previously recorded, now you're going to record that the class 1 chemical indicators in your packs have changed color, so we know that they've been affected by steam. Results of any other indicators, whether you've got a class 5, 4, 5, 6 indicator in your machine. Correct time at temperature of the sterilization cycle was achieved, so we may look at the printout, or we may be looking at the information on the screen of the machine. Conditions of the pack, whether they're dry and intact, any other comments if you've failed the cycle, and the identification of the person who released the load. So when you're looking at a printout, I've circled that area, and it'll say different things for different machines, but you'll generally see, like, some of them say SS, or this one says PRS, PRE, whatever, but it's the sterilization time. So this machine, you can see it went into sterilization, which is the PRS. It was hit at 134 degrees, and then its holding time was 4 minutes. You can see how it's counted across to 4 minutes. In that 4-minute period, you need to identify the highest temperature. So the highest temperature was 135.7 in that particular load. These are the different types of indicators that you might use in part of your tracking. So now when we're filling out the book, we're looking at the right-hand side. So we're saying whether the cycle passed, what the sterilizing temperature was, so what the highest temperature it was during sterilization cycle, the time it held for, which was 4 minutes for that particular printout that we looked at before, the name of the person who checked the load. So you write your name, you sign, and then if you affix an indicator, a class 6 indicator, or whatever, if you've used it there, you can put your tracking labels or whatever in there as well. Or you can put your printout, you can attach your printout, whatever you want to do. If you don't have a printer, that's fine too. Most modern sterilizers have USBs now that record all the cycle information. So long as you're keeping that cycle information, you're seeing on the machine that it's coming up confirmed that it's passed the cycle, you can go back and check the cycle information via the cycles recorded on the USB stick. For step 9, storage. All packed and wrapped sterile items must be stored to ensure sterility is maintained. They must be stored in an environment which is cleaned regularly with detergent and water. So this is what I was talking about. This needs to be recorded on your cleaning guidelines as well. They need to be protected from environmental contamination. So they must be in a covered container or designated drawer and cupboard that can be closed, stored in order of sterilizing date. So make sure that you're putting your um, longest from sterilization date at the front and the newest sterilization date at the back, stored away from sharp objects which might damage the packs, and a clear system of stock rotation must be maintained to ensure older stock is used before newer stock. So we also need to clean our sterilizer. The sterilizer works hard for us, so make sure you look after the sterilizer as well. So your routine cleaning should be following the manufacturer's instructions as well, but should also involve damp dusting of all the external surfaces of the machine. If you look at your machines, you'll often see there's like little fish gills or something on the side of them. They're actually air vents. So please check those air vents. If you see that they're full of fluff and lint and things, clean them, get rid of that stuff because that's where your air is actually coming into the machine to help your machine work. If those gills get clogged, then that can cause your machine to stop working as well. If sterilized trays and loading, we need to clean our trays and racks. We need to clean them weekly or if they're soiled. The chamber should be cleaned with a soft, low-length cloth. If you're going to use detergent, that's fine, but make sure you rinse that out really, really well. You don't want to be leaving any residual detergent. Generally, I'd just say clean with a low-length cloth and water. But sometimes if it's, got contamination, especially if it's like a dental surgery from oil, you may want to use a detergent or a cleaning agent. Just make sure you clean that cleaning agent off really well before you start processing again. If you have a chamber drain in your machine at the bottom of the machine, then that should be checked and cleaned. So look inside your machine and see if it does have a drain. The door gasket should be checked and cleaned, and you need to be doing that, I'd say, every day. Just every day, use a damp, low length cloth and clean your door gasket. Just rub around it, get all the door, any lint or anything off of that door seal. And also drain the distilled water reservoirs, especially if you're, going away, closing down for a little while. Make sure you drain all the water out of your dirty and your clean tank. And the cleaning should be documented as part of your regular cleaning program. So when we're looking at performance testing, special performance tests for steam sterilizers using mechanical means that this is straight out of the standard. So 7.7.3, this is the area in the standard that it's talking about. The leak rate vacuum test. So as I said before, you need to do that if your machine has a vacuum test, but you need to do a risk analysis around how often you need to do that vacuum test. An air removal and steam penetration test, which is a Bowie-Dick test, should be undertaken on each day of use for sterilizers with B class cycles. So that's your hollow instrument. Sterilizers with S class used for removal of air from hollow A and hollow B. If you don't process hollow instruments, then you don't need to be doing the air removal of the Bowie-Dick test. So suggested risk analysis is around this. So 7.7.3.1, the leak rate vacuum test. Our surgery only reprocesses solid reusable medical devices and does not process any hollow instruments. So the risk associated with doing a daily vacuum test is low. Therefore, we will only perform a vacuum test weekly to ensure the correct functioning of the vacuum pump in our sterilizer. And that could be a risk analysis for a MELAG 23VS. Air removal and steam penetration. Our surgery does not perform any hollow A or B type instruments. Therefore, the need to test with Bowie-Dick style tests is not required as per Australian Standard 4815. Or our surgery processes hollow type instruments and or wrapped loads. So we perform a Bowie-Dick test on the days these loads are processed. So that's if you have like a MELAG Pro Class B. So if you do B loads, then that could be your risk assessment that you do for your machine. These may all change next year when the new standard comes out. They may say, they may change what's happening with these tests at the moment, performance testing, but at the moment, this is okay. So when you're getting your performance qualification done, the Public Health Act states that you must review your policies and procedures and make any changes, and you must do this on a yearly basis. So this is over and above what AGPAL requires you for your policy and procedure within your surgery. This is what public health says. You must be checking your policies and procedures on a yearly basis and making any changes. So you select a challenge pack and determine your challenge load. So a challenge pack is the pack with the most instruments, the most dense pack that you would process every day. And then that pack would be within your challenge load. Your challenge load is basically the most instrument sets that you will process in the sterilizer at any given time. You need to make sure when you're ordering your performance qualification on your machine that you also make sure you have your biological indicators for your confirming your lethality. Then your service technician is going to visit. You're going to present him with your challenge load for validation. He's going to do the process. He's going to sterilize your challenge load. He's going to put the challenge pack in the cold spot after the cold spot of the machine's identified. And then you're going to process your biological indicators per load, one inside the challenge pack and one in the cold spot. You're going to do that in 3 consecutive cycles, either at the time of validation or immediately after. When you're processing those biological indicators, please make sure that you don't put them right up against metal, against an instrument so that they're not sitting right up. Please wrap them in a piece of gauze or a bit of low-length towel or something, because what happens is if they're sitting up straight against metal, then the metal can cause stress on the plastic, and then when they're processed, they can split, and then you'll have to do the whole biological indicators again. So always wrap them, protect them from metal. Even the one that you're putting in the cold spot, wrap it so it's not sitting directly on your metal trays. You're going to send your biological indicators off for incubation. Label indicators are usually your Z is your control. It doesn't go inside the sterilizer. You don't even process it. And then your P1, 2, and 3 are inside your challenge packs. And then your C1, 2, and 3 are in your cold spots. So P1 and C1 will go in your first sterilization load, P2 and C2 in the second, P3 and C3 in the third. Then you're going to sign off. Once you've done your validation, you'll get all your paperwork back from the technician who did your validation, and you're going to sign off, educate your staff, don't exceed the challenge load that you've given the technician, and document everything that's happened. Also document your validation cycles in the sterilizer log. So the technician basically is doing procedures that should check and confirm the heat distribution study to identify cold spot. Temperatures and pressures are checked with an independent instrumentation. Confirmed challenge load does not exceed the machine's capability, so they need to know that, what's happening. I think in the new standard, you're pretty much going to have to weigh your load. So that will be something extra that you will do. You will have to the technician will have to weigh the load you present, make sure that it doesn't exceed the machine's capability. And if it does, then they'll have to ask you to redetermine your load and make sure that it fits within the capability of the machine. Pack steam penetration time identified. So when they put the probes in the machine, they're going to put one probe inside your challenge pack, and they're going to make sure that the temperature is reached inside the pack at the same time as the outside of the load, or if it takes longer to reach steam penetration within your challenge pack, then they'll adjust the whole sterilization holding time to make sure that the 3 minutes is still met within that challenge pack. It may extend your time on the whole processing of the sterilization cycle. Time at temperature is identified, and that's 135 to 134 degrees at 3 minutes. So they identify and make sure that that is being met. They calculate the total processing time. So, if it takes an extra 30 seconds to reach the right temperature in your pack, then they will set it so that your time at temperature is set for 3.5 minutes to make sure that everything is still got the right processing time. Confirm parameters, settings comply with required time at temperature, which I was just talking about. So your total penetration time equals your pack penetration time plus your sterilization holding time. So if that 3 minutes at 134 degrees. I hope that was clear. The PQ, your validation needs to be performed after commissioning. So when you get a brand new machine, whenever product packaging or load patterns are altered. So if you change what you're doing or add in new instruments to your surgery, then you will need to get your machine revalidated for the new equipment. Or if parameters for a load, special sterilizer load are not within previously established limits. So sometimes we'll get people going, oh, well, we're going to, we're using a plastic item, so we want to sterilize at 121 degrees. Do I need to validation performed? My answer is yes, because they're two totally different load types at two different temperatures. So if you're processing some metal instruments at 134 degrees, you need validation for that load. If you're processing some plastics or smaller, items that can't be processed at the higher temperature, then you need another validation to prove the lethality of the processing at the 121 degrees. So yes, you do need different validations. So performance requalification should be performed at least annually if none of the above events has occurred. Sometimes if you have a major repair on your sterilizer, maybe the vacuum pump or something like that is changed, or the main circuit board, something like that, then the technician may say to you, you need to have a re-performance qualification done again. Okay, that's me.
You are doing so well, and I know everybody's muted, but you have a sip of water, Jane,
Yes.
before we go to the questions. And I will just, on behalf of everyone.
I tried to get it all in. There's so much information.
You did so well. So here we go. I am going to officially clap on behalf of all of us. That was a wealth of knowledge packed into to an hour. You took us from the start of the day into the step 1 to 10 of the reprocessing cycle, and there's so much information. So thank you so much. Have that sip of water, because we have lots of questions. And you wouldn't know, but there's been a whole world going on in the chats.
I'm sure.
You can see it later. The fantastic team behind the scene has gathered questions. So I actually have them here, and we will now, when you've had your sip of water, go into what I might call like a radio quiz, where I throw a question, you answer. I throw one, you answer. So we'll just try and do it really short, sharp to get through the questions. How does that sound?
Sounds perfect.
Perfect. Beautiful. Without no priority, we start from the top. How does the cleaning process differ with a washer disinfector versus ultrasonic?
So a washer disinfector, basically, you don't have to do any pre-cleaning, whatever. You're just bringing the instruments straight out of the surgery. You're stacking them into, it's basically like a dishwasher. You're stacking all the instruments into the washer. You load it up. You shut the door. You press the button, turn it on. You come back in about, most of them take about 60 to 90 minutes, depending on the brand. You come back in that after that period of time when the cycle's completed. You open the door, everything's dry. You take it straight out, you package it and put it in the sterilizer. So you're getting rid of all your manual handling of your instruments. So with manual cleaning, you've got to bring it in, you've got to either brush it or put them straight into the ultrasonic. You're still handling all the time. So having that thermal disinfector also reduces the risk of sharp injuries, because nobody's handling instruments. You're just putting them in the washer and going.
Fantastic, thank you. And keep holding your microphone up for this, because I know people are on the front of their seats leaning in to hear your answers. Question number 2. What should the instrument preparation be before a washer disinfector? You might have
before the washer disinfector, pretty much nothing. So you're still just going to give them a wipe at the point of use. You don't have to, but it is still better if you wipe them at the point of use, as you do, just getting off your gross blood or whatever at the point of use, and then you just put them straight into the washer disinfector. You don't have to do anything else.
Fantastic. Next question. Is the color changing built-in tap on the autoclave bag, is that a class 1 chemical indicator?
Yes, it is. Class 1.
Beautiful. Ah, that was a good, clear, quick question. We'll keep moving. You're doing great. When rinsing with demineralized water, I'm sorry for the Danish accents for some of you.
Yeah.
Yeah. When rinsing with a demineralized water, how do you recommend doing this? Just pouring it out of the container over the instruments, or is there a more efficient way?
Pretty much just pouring it out of the container and over the instruments. Yes, that's all you can do. I really highly recommend considering getting a reverse osmosis unit that can go underneath your sink. It generates about 50 litres of water a day. Then you're not having to go to the supermarket and buy all these heavy bottles of water. And then it has a tap on your sink. So once you rinse your instruments under the hot water, get all your detergent off. And I can't just keep saying rinse, 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 get all that detergent off, because one of the big things that kills sterilizers is detergent on the instruments going through the machine, because you've got to understand steam when it goes into the machine is actually water. So if you've left detergent on your instruments, it just bubbles up inside the chamber. So if you've got a lot of detergent in your chamber, you're not actually getting steam onto your instruments. So your instruments aren't actually processing properly. So
Great.
short answer is buy an RO unit, get a tap, and then you can just rinse them under a tap. Much easier.
Amazing. Next one, you talked about transporting. What about transporting used equipment within the same room? Is that okay on the trolley used to hold them during the procedure?
Yes, within the same room.
Perfect, thank you. Next, is it recommended to soak instruments as the first step in the cleaning process? And I think you answered it and they found out, but let's do it anyway.
No, it's not necessarily recommended. It's only recommended if you can't clean them straight away.
Perfect. Next one. When packing a sterilizer, should bowls face up or down when sterilizing? I feel like we're in a trivia,
Down.
Jane.
Down.
This is a very
Or
special
sideways.
trivia.
Actually, bowls are better actually even sideways. So even if you can do them sideways, but if you can't prop them sideways, then down.
Fantastic, thank you. So, are nail clippers semi-critical or non-critical?
They are critical because nail clippers can potentially cut skin. So because if you're not 100% careful with a nail clipper, if you have the ability to draw blood with a nail clipper, then you would have to treat it as a critical item.
Yeah, thank you. Next one. Once the instruments are processed and stored for 6 months plus, should we be reprocessing the instruments before use?
So if you've got a machine that processes like a barcode printout and it says that it has a 6-month, like some of the Miele Pro classes, if you go with the barcode printers, it prints out a label saying that it's you have to reprocess in 6 months. Then if the label that's printed out says 6 months, then yes, that's what you do. But the standards and even the Australian guidelines for the prevention and control of infection in healthcare, they state it's a situation based. So you need to be looking at the packs. If the pack is still intact and it's been stored in a clean, dry environment, then no, there's no end date for the sterilisation when you have to reprocess. It's based on the integrity of the bag.
Great, thank you. We have 2 more, and then we'll go on to the next part as well. So type S sterilizer. Do we need to do helix testing?
No,
No
you
hollow
can't.
instruments used.
An S class is never going to pass a helix test. It's a waste of time even trying and a waste of money. It's not going to pass.
Thank you. How often do you change Clinidet solution if made up and not used?
Daily. You should be changing your detergents daily.
Daily. That's fantastic. Thank you for your questions. We're going to pause here for a moment. And while you stop sharing your presentation, we will hand over now, and we'll come back and thank Jane more. We'll hand over to Anne-Maria Gibbs from Practice Hub. Anne-Maria is the founder of Practice Hub, and it's a software that can help you keep track of all of this. So Anne-Maria will give us a short snippet, a few examples of how it can help clinics with compliance. And if you're interested in the full demo, let us know in the little survey at the end, and she's happy to. Thank you, Anne-Maria. Take it away for the next 5 minutes.
5 minutes it is. Thank you very much. And Jane, can I say what an amazing performance? That was just so fascinating. I think the thing I'll take away is the sterilizer is not a cupboard, as someone who doesn't actually do sterilizing, but I thought that was a very good line. All right, so I'm here to talk about Practice Hub, and I'm really going to focus on what Jane has been talking about tonight, which is around sterilization. So for those of you who don't know, Practice Hub is a platform that helps you to manage the documentation and compliance that you need, I guess, when running your practice. So you can see from the side menu here, there are a lot of different options. So we have policy and procedures manual, a tasks area. I'll look at the equipment register, but there's other registers. We have automated credentialing, so APRA alerts where you can see if your practitioners are appropriately registered or if there's any changing, and we have training modules. But this evening, I'd like to focus on some of the policies and procedures that we have. So we provide our customers with a suite of templates, and depending on what kind of your practice you're in, those templates are generally configured in line with whatever standards may apply. So for general practice, our policies and procedures, you'll just quickly see, align with the RACGP standards. And in terms of sterilisation, we have policies and procedures around validation that we've talked about. And really, the idea is, and I know Jane mentioned that it was really important that you needed to review these every year, these policies, when you do your validation. And one of the great things with Practice Hub, or one of several of the good things, is that we can provide you with policies and procedures that have been written by experts in that area already. The other thing that you can do, you can see you can customize the information. So really, instead of you writing this stuff from scratch, we're giving you some templates to work with. Other good things that you'll note is you can set up that frequency. So how often do I need to review this policy? Well, I'm going to do it every year in line with when I do my validation of my sterilizer. I have an audit trail of any changes that I make to that policy over time. And also I have the ability to link each policy to the relevant criterion in the standards, which is a really nice way of being able to link why you do what you do for the people in your team. There was also some discussion this evening about tracking and tracing. So we again have a policy around that as well. And as you can see, it's really simple, it's well written, and that you essentially go through and insert the information specific to your practice. And this allows you to focus on being able to do what you need to do. It is fantastic for induction of new staff because you're giving them clear, transparent, accessible information that explains how things are done in your practice. And you can see we've got a lot of the documentation there, or the steps, which probably mirror, I'm sure they mirror what Jane has talked about as well this evening. Now, speaking to Gillian earlier in the week, she was talking about sterilisation tracking, and she said, what about reverse tracking in Practice Hub? So I had a bit of a think about this, and I think my understanding is that many of you use like a simple register, and it might be that, you know, at the end of every month you upload that or store it and start a new one. And I think one of the things you can do is actually put those in your Practice Hub site. So you can see here, I've related it back to the tracking and tracing page, but this is in fact the register that Gillian created that Jane showed earlier. And you can simply print that out or electronically complete it every month and then upload the completed version into Practice Hub. And the really good thing about that is that when it comes to accreditation and showing the evidence, you will have the information here, you'll have your policies and procedures, you'll have your tracking register, and then you'll also have the information about your sterilizer in the equipment register. Now, the equipment register is really good in terms of being able to define how often maintenance and calibration or certification needs to be done, to set those dates up in the system so that you get reminders before they're actually due. You can treat it like an asset register and include information around, the serial number, the model, where it's kept, etc. Is it owned? Is it rented or leased? And that sort of thing. And one of the things I like to do is actually put a link into the user manual. So often I think we've got so much equipment in our practices that keeping track of all the user manuals can be tricky, but you can put a link to it because most of those things are online now. And so if we think about it, over time, we'll have our sterilizer validated on a regular basis. And each time it's done, you'll be able to upload the report. So 2019, 2020, I haven't put 2021 yet, but I know when it's next due to be done, which will be September. So all in one place, we're setting a reminder as to when the maintenance needs to be done. We've documented the details about the items, so we're not as I say, a bit like an asset register. And finally, any documentation, so whether it was your initial purchase, invoice, receipt, any other information, can all be uploaded and linked to that item. And from an accreditation point of view, you can give the assessors access to your Practice Hub site, and they can go in and see that information. As Anne-Lone said, please, in the mini survey, indicate if you'd like to know more about Practice Hub, or go and visit our website at practicehub.com.au. And I think that is my 5 minutes.
Well done. Well done. Thanks, Maria, for sharing that and some very specific examples linking into what we've heard about tonight. So while you stop sharing and Andrew gets the QR code up on the screen, I would like all of you, please take 1 minute now. We'll have the QR code on the screen, and you'll see in the chat box, if you prefer, there's a link. This is a short 1 minute survey. I would love you to complete it now, because if you don't do it now, it will never happen. And it will really help us improve the webinars, and please add ideas to things you would like to hear about. So either use the QR code on the screen, take your phone and scan that right now, or click the link in the chat box that Andrew has just put in, and it will open another browser. And please answer these questions there. That would be really helpful for us. And as we said, there's a question: if you or your practice manager would like a full demo of the Practice Hub software, then just say yes and put your details in there. I'll just give you a little minute to fill out. And Jane, if you've had water, and if you're happy, you don't need to come back presenting, but if you're happy to just come off mute, there was a little extra question that sneaked in just now. If you're happy to answer that one, can you fold a bag to fit in the sterilizer?
It's probably not ideal if you've got to fold a bag. Yeah, I'm sort of wondering why you would get a bag that's too big for the sterilizer. You really should be choosing a bag that is more suitable to the instrument. And generally, I would say no, you shouldn't be folding bags.
Great. Thanks for that one. I knew I was going to open a can of worms, because we might get even more. But okay, thanks for that question on certificate. The team will answer that one in the chat. And thanks to all of you. Feel free to continue filling out the survey now, or you can just leave that browser open and finish it in a minute. So any other last minute questions for Jane?
There's one.
Yeah.
There's one there. Also, are you planning review of the new guidelines? The answer to that is yes, but the new standards sort of it was out for discussion, which closed at the end of January. Then the new standard was supposed to be released in April. It wasn't released in April, so once it does come out, then I'll be having a very riveting weekend reading that guideline, the new standard, so that I understand it, and then we'll come back with any updates after that. That's
fantastic. Thanks, Jane. And Andrew, if you take us to the next slide, and we have lots of thank yous coming through, and we will thank you again, Jane, at the end. But tomorrow you will all get an email, with a link to the video, so you can go back, you can share it with your colleagues. It's on our events page on the teammed.com.au website, where we have all our events and the watch on demand videos. But you'll get an email tomorrow where the link is there. There'll also be a link to the certificate. So click there and print, download, save your certificate. And then we thought, just to make sure you open that email tomorrow, the team has put in a little voucher where you, until the 9th of September, can spend $200 with us through your existing account. Or if you're not customers with us yet, go online and come in as a web guest. Thanks for the smiley faces there. And you'll get a free water bottle. Just like we all need a sip of water, and that will definitely make you happy, one of those. So with that, thank you. Thanks to all of you for spending your evening with us. Education with Team, we are continuing because we're getting great feedback. And we have such a vast network of industry leaders and knowledgeable suppliers and people. So we love sharing that with you all. So thanks for continuing to fill out the survey. Let us know any topics you would like, because we are planning for the whole next year. So please put that in there as well. Let me just check, but I think that was all the practical stuff. So a last thank you to you, Jane. That was absolutely amazing. Thanks, Jillian, for connecting us in the first place. And that wealth of knowledge is fantastic. And all of you curious to go through it again, that watch on demand, you can go through everything. You'll see the slides on there. You'll hear Jane's explanations. I have made massive notes about little snippets that we can even edit and use, because there was lots of gold nuggets in there, Jane. So thank you so much. And you'll see all the thank yous coming through. Thank you, everyone. Really appreciate your passion. And
thank you, everybody, for listening. It's like I said, it's absolutely riveting subject. I tried to make it as interesting as possible. So thank you.
You definitely did, and a lot of people have learned a lot, and will continue that dialogue and the questions. So thank you, everyone. This is it. Enjoy your evening. You've got 5 minutes back, and we'll see you at the next one. Thank you all.